yung ating newborn? Days or months? Yung age ng ating newborn, ilan?
0 to 1 po, ma'am.
0 to 1, very good. Okay? Specifically, how many days yung ating newborn?
28 po, ma'am.
Very good, 28 days. So, kapag lumampas na siya ng 28 days, so makonsider na siya as infant. So, yung range naman ng ating infant, how many months? Yung infancy stage. Months. Just a review. Okay? So, para makonsider siya as infant mo in terms with the age, number of months, ganyan. Okay? Yung edad ng ating infant, eh, how many months siya to be considered as an infant?
1 to 12 months po.
Okay, very good. No, 1 to 12 months. So the moment no na mag 1 month old no or more than 28 days na yung ating newborn, so hindi na siya newborn. Okay? So doon na siya mabelong sa ating infancy stage. Okay? Sige, very good. How about, in our infancy, what is that psychosexual stage ng ating infancy?
Oral
As
po, ma'am.
Oral stage, very good. According to, kanino nga yung theory?
Sigmund
Psychosexual
Freud po.
Sigmund Freud, very good. Okay, so naka-answer dito yung exam, very good. How about, according to the theory of Erik Erikson, which is your psychosocial stage, ano yung task ng ating infant?
Trust and mistrust po, ma'am.
So, trust versus mistrust. Okay? So we're in, no? Yung ating infants will learn to love and learn how to love and learn how to be loved. Okay? Very good. Na-remember pa yun. Okay? Next, ano naman yung cognitive stage ng ating infant? Hello, marinig ba ako dito?
Marinig na po, ma'am.
Okay, sorry. Na-mute ko. Mute na ako ganina kay nag-change ko. Ay, wait lang. Wala pa din ni background. Kay nag-change ko og unsa ni? Kanang device, no? Kay nibalik na gid ang kuryente. Salamat. Okay? I-background na to kay hugo kay ang balay char. Okay? Sige. So again, going back no sa ating infancy stage. Ano nga siyang cognitive stage? In talking about your cognitive stage, saan na belong yung ating infancy?
Sensory motor stage po.
Okay, very good. The sensory motor stage. Okay? So, sino nga nag-develop ng ating cognitive stage? Ay, cognitive stage. Ang cognitive theory, rather, sino ang develop nun? We have? Okay, very good. You have Jean or Jean, no? Pagbasa Jean daw, okay? Jean Piaget. Okay, very good. So, that is your infancy, no? A recap on your infancy stage. Okay, wait lang. Makita man aking slides, no? Mag-record ako sa cloud, ha? Okay. Sige. So, tomorrow, since first meeting pa natin
Recording
sa
in progress.
so hindi ko na lang muna introduce. Okay, but then, kung saan man introduce ma, meron tayong agreement. Okay, every ano na lang siya, every Friday. Okay? So, every Friday, we will have an agreement. Tomorrow na nako pod iingon. Okay? Kung saan man ang agreement, tomorrow na yun. Okay? Relax at takaron. Okay? So, welcome no to your infancy stage. So, again, ito yung mga nabanggit natin kanina. Oh, hindi siya mabalhin. Yan. Okay? So, that is your infancy stage. 1 month to 1 year. Yes, 1 year. Exactly 1 year ito ha. Exactly 12 months. Okay? Pag maglampas na siya ng 12 months, okay? 12 months and 1 month. So basically 13 months, 14 months, 15, 16 months. So that is already considered as unsa man. Infant pa ba siya or unsa?
Toddler po, ma'am.
In terms of Toddler, very good. So in terms of the age, toddler na yung ating baby pag maglampas na ng 12 months. Okay? So basically, again, infancy is 12 months and below. Okay? So 1 month to 1 year. Exactly 1 year. Okay? Very good. Next, wait lang ha. Ano ko lang yung aking pen. Ayan, okay? So we're done with this one. Okay na ito. And then, yan. Sensory motor, we're in, diba? Relying on the senses yung ating infant. Okay? And then this time, no, fear. Ang kanyang fear ng ating infants, okay? So you have the stranger, no? Stranger anxiety, and then ang play niya is solitary play. What is the solitary play? That signifies no na si baby natin, no, yung ating infant, they love to play with their bodies, okay? They are exploring through their senses, and then ang play nila malingaw sila with their own bodies. So, sama na ma'am, kanang kamot, no, dula-dulaan, yang kauna niyang kamot, yang kauna niyang tiil, that is solitary play. Malingaw lang siya with his, no, or her kanang body. And then, stranger anxiety, basically, yes, biting, no, ginabite niya iyang kamot, ginabite ang tiil maabot diri sa kuan, very flexible masyado, okay? So, yan yung ating solitary play, no, siya lang mag-isa, malingaw siya on his or her own, yung ating infant, kasi nga, no, gina-explore nga iyang body, okay? Next, ang fear naman is stranger anxiety, since no, this is the building of trust, no, ng ating baby. So basically, magkaroon siya ng stranger anxiety, meaning no, that is healthy kasi naka-build, meaning noon kapag meron siyang stranger anxiety, naanad siya, no, or na-used siya sa isang, or na-used kanang naanad siya, kumbaga na-used siya na kanang isa lang ang kanyang primary caregiver, or meron siyang constant caregiver, and that is a good thing since no, nasanay siya na meron siyang constant caregiver. With that constant caregiver, naka-develop siya ng trust. So later on, pag maka-encounter siya ng another, no, na person, new person, magkaroon siya ng anxiety. So ang mag-manifest sa ating baby as crying, di siya mo duol sa katong new person, no, di siya mo tanaw sa new person, maghilak siya, no, mag-tantrums, or mag-iyak siya kapag nang doon yung new person na yun, ayaw niya doon sa new person, gusto niya doon lang siya sa kanyang primary caregiver, okay? So that is stranger anxiety, no, kanang ginaingon nila, di ba, sa Bisaya pa, muila naman ni, okay? So ang gusto mo, doon lang si baby sa katong mga kauban niya, makita niya permente sa balay, pero kapag tao na kanyang bago niya lang nakita, hindi siya moduol, okay? Ayaw niyang makihalubilo doon sa tao na yun na bago niya lang nakita, and that is stranger anxiety, which is perfectly normal for our infancy, okay? Sige. So, before we go on to our development, diba, magkaiba, no? We learned in our previous discussions that growth and development is different. Okay? Unsa ganito ilahang difference? When you say growth, what is that? Kapag sinabi nating growth.
Development, ma'am.
Sorry. Okay, physical. Okay, very good. Okay, physical growth, no, or your, no, measurable, the quantitative na growth ng ating baby. Okay, very good. How about development? What do you mean by development? Si development naman, kung si growth is quantitative, si development is qualitative. Very good. So, measurable siya through, or ma-measure or ma-assess natin siya through observations. Okay? Assessing, or qualitative, assessing the abilities, no, and skills of the child. Okay? Very good. So before we proceed to our development, let's first discuss your growth muna. Talking about, of course, pinakauna, your physical growth. Okay? So physical growth, mauna si weight. Okay? So as we have mentioned, I think, no, na-mention na gid nato ni siya, okay, during our kanang overview, no, with each age group, sa weight ng ating infant, okay? So mag-double ang kanya, again, no, the basis natin, the very basis is our birth weight, okay? Mag-double ang kanyang birth weight pag within the range of 4 to 7 months, and then 6 months yung average, okay? Okay, yan. 6 months yung average. That's why, no, dramatic changes, no, na mangyari kapag with regards to the weight of our infant, with regards to the weight of our infant. Okay? That's why, very important yung ating well baby checkups, di ba? magpa-check up no mo ato kanang dili ideally yung ating infant, especially with the first 6 months, okay, or within the 1 year, di ba kanang 1 year nag-CHN na ba mo, tama ba ko kay DR man mo hi, nice to see you by the way, ang tuin no nagkita gyud ta sa DR, okay, kumusta man inyong skills lab. Kamusta mangumusta sa ako segue lang ko dirabi kay marag bago ra gyud napay mga naibungot. Di ready dapat ha when you go on duty. Okay? So you already know our policies. So okay na, naka-shave na to, nakapagupit na ba? O nakapagupit naman po in taon. Okay? So ready na gyud by next week. So dapat ready na kaayo gyud mag-duty ha. Sige. So going back no sa ating discussion, kay human naman mo si HN, di ba? Kailan nyo ma-consider na fully immunized child yung ating baby or yung ating child? Ilan ang kanilang age pag fully immunized? Ba na ma? Huh? Ay, wait lang. Nana ba na? Nana ba mo ana? Or IMCI ba?
Complete ang vaccination, ma'am, before
Yes.
1 month, 1 year po.
Okay, yes. 1 year, no? So, fully immunized child, ma-complete yung vaccinations before 1 year or exactly 1 year, no? Katong, di ba? Katong, okay, before mag 1 year old. So basically, within the infancy. That's why, very important yung ating check-ups, no? Not necessarily magpa-check up si baby na kanang ano lang, na kanang nasa sakit. So specifically, during the infancy, meron tayong mga well baby check-ups, okay? So during the 6 month or during after 1 month, no? So newborn, di ba? So na naman na tira. And then, ma-discharge na sila sa hospital. After how many weeks, mabalik si mother. And then, nalapoy follow-up check-up, no? So those are your well baby check-ups. So yung well baby check-ups natin, that is, no, depende na yan siya kay mother kung dito ba siya sa iyahang pedya or pwede ra po siya dito mag well baby check-up sa ating health center. So depende na sa kanya. So for example, kung dito siya sa sa tawag na to ni, kung dito siya sa iyang pedya mismo, of course, sa clinic ng doktor, okay, so i-assess siya ni doctor, ganyan si doctor mag-assess. But kung sa health center, depende na kung sino yung available. Mostly, meron naman din siyang doctors, but not all the time. But mostly, ang available natin are registered nurses and midwives, yung magwa-well baby check-up. Okay? So usually, si midwife sa buntis man na siya usually, okay? So, but yung midwives natin sa health center, pwede po sila magkuan baby check-up pag newborn. But then, kapag kuan na sini dako-dako na infancy na gyud no infancy stage kay doon na sila sa registered nurses, and then doon din yung ating well baby check-ups that would provide no the opportunity para ma-check yung growth and development ng ating baby. So, aside from that, maupot yung opportunity para mahatag yung mga immunizations no, and vaccines natin. Okay? So, talking about ma-monitor yung growth and development ng ating baby. So, naman ay booklet no, na ginahatag sa health center. I think ma-encounter nyo yan siya once you go on duty next semester during your IMCI rotation. So, basically, CHN pa rin siya. Pero, di ba, yung CHN ninyo, ngayon na semester is focused on pregnancy, okay? But then, next semester, meron pa rin CHN na rotation but focused na siya on sick children. So with that, monitor nyo din ang growth and development ng ating child. Okay? So diba, lahat ng rotations na yon basically present pa rin siya sa next semester, pero next semester is more on the kanang mga abnormalities na, no, mga sakit-sakit. Okay? So now, mga well clients pa, but next sem, so mga sakit, no, medyo complicated na. Okay? So again, no, yung well baby checkups natin, it would provide no our healthcare providers na ma-monitor yung growth and development. So in the growth, ma-monitor yung weight ng ating baby. Okay? So sa weight naman, no, paano natin malaman if the baby is gaining weight, no? Kanang normal yung kanyang pag-gain ng weight. Okay? So as we have already discussed, no, mag-double ang weight ng baby by 4 to 7 months, no, or 4 to 6 months, average yung ating 6 months. For example, sa birth weight tayo mag-base, for example, ang birth weight niya is 3 kilograms, okay? Upon birth, no, or after delivery, di ba, i-weigh natin si baby, okay, di ba, yung newborn care, no, i-weigh si baby. So, yung birth weight na yun yung maging basis later on or yun yung magiging basis sa growth and development ng baby. So, after, for example, no, average kay 6 months man, okay? So, after 6 months, i-weigh na naman, i-compare na naman yung weight ng baby. So, dapat pila na iyahang weight. For example, if iyahang patang when you say kung mag-double ang iyahang birth weight, pila dapat iyahang weight pagka 6 months?
Kilograms po.
6 kilograms. Very good, no? So, basically, 3 times 2 lang. And then, pagka 1 year, no, mag-triple ang birth weight pagka 1 year or 12 months. So, pag 1 year, by the end of your infancy stage, magti-triple na yung ating birth weight. So, basically, magiging 9 kilograms na siya. Okay, yung ating expected, no, na weight ng ating baby. Okay, very good, 9 kilograms. And then, here, no, sa average weight gain, okay, ang each month, no, na weight gain ng ating baby for the first 6 months. So, 1 month to 6 months, okay, 2 pounds per month dapat yung weight gain. Okay, nakuha. That's why, and then towards the end of our 6 months, no, or 4 to 7 months, okay, dapat mag-double na yung weight ng ating baby. And then, during the second half, no, of the year, so second 6 months, so that is from 7 months to 12 months, so 1 pound per month na lang ang i-gain ng weight ng ating baby. Okay? Sige, next. Average, no, na weight ng 1-year-old child kapag boy, depende yun siya, mag-matter yun siya sa ano ha, kasi tawag na to, ani, sometimes, no, mag-matter siya with the gender kasi boys are anatomically, no, physiologically bigger than the girls, okay? So, with this, no, yung boys natin, average 1-year-old boy weighs 10 kilograms or 22 pounds. And then average 1-year-old girl weighs 9.5 kilograms or 21 pounds. Okay? But again, average lang yan siya. Okay? 50% of the population. Hindi yan siya true to all. Okay? So, pwedeng lesser. Okay? But, ang bottom line nito, dapat, no, according to, again, ang basis natin will be the birth weight pa rin. So, birth weight, from the birth weight, mag-double siya at 4 to 6 months. And then, mag-triple by the end of 1 year. Okay? Next, you have here your height. Okay? So, sa height naman, okay, paano nga tayo mag-measure ng height kapag newborn?
From here
pa-
to 6 months.
Okay, very good, no? So basically, yung height natin, yun siyang length, 'di ba? During the newborn stage, okay? So katong pag newborn care ninyo, so okay, very good. From heel to the vertex or the occiput, okay? Very good. Okay? So yun yung ating birth height or the length of the newborn. So doon, no, doon pa rin tayo mag-base, okay? So by the first year, okay, by the end, no, of the first year, mag-increase dapat yung height ng ating baby by 50%. Okay, answer pala ito. Akala ko question. Vertex, heel to vertex. Okay? So, mauna muna sa foot ha. So, from the foot, pataas. Okay? So, with that, no, wait lang. So, by the end of 1 year, dapat mag-increase ng 50% from the birth height. For example, ilan gani ang normal natin, no? Normal range for our length. Ilan yung normal? Okay, very good. Okay, so ready na gid mag-duty og DR. Okay, 48 to 53 centimeters. For example, no, ang kanyang birth length, no, ang birth height ng ating baby is 50 centimeters. Okay, so at birth 50 cm inyong sa tawag na to ani pag-measure, okay? So ang sabi dito, by first year, no, by the end of 1 year, mag-increase siya by 50%. So ano ang 50% ng 50 divided by 2, di ba? 25. So dapat, no, by 1 year approximately, so 50 plus 25, so dapat approximately 75 centimeters na ang height ng ating baby by the end of 1 year. Yun yung ibig sabihin nito, okay? Ma'am, present. Okay, yes, nagbuba ang iPad. Oh no. Sige, note ko lang dito. Okay, present na. Sige, thank you for informing. Okay? That's why ang average natin, no, average, again, depende pa rin ito sa average lang. Kasi magdepende pa rin siya sa ating birth height. Okay? So, average na height ng ating 1-year-old child should be 20 to 30 inches or 50.8 to 76.2 centimeters. Okay? So, yun ating example. Okay, for example, 50 centimeters ang iyang height. So, again, mag-increase dapat by 50%. So, 50% of 50 is 25. So, 50 plus 25 is 75. So, by 1 year, you would expect no, na 75 cms na yung height ng ating baby. Okay? So, here, for the first half, ang appearance naman ng pag-grow ng baby, sa height ng baby, for the first half of the first year, the first 6 months, no, ang growth no, is more mapansin siya sa trunk. No, dito sa body ng ating baby, dito yung mapansin mo na growth. While the second half of the first year, okay? So, during the 7 to 12 months, lengthening of the legs naman ang mapansin mo na growth. Okay? So, yan. But then, equal proportionate, somewhat proportionate pa rin siya, ha? Okay? Especially, sa second half, yung mag-appear na mag-lengthen ang legs ng baby because during this time, no, dito natin mapansin si baby na nag-bear na ng weight sa kanyang legs. Okay? So, meaning, no, nag-try na siya na maglakad-lakad. Okay? That's why mas mapansin siya. Okay? Compared sa first 6 months na medyo nakahiga pa yung ating baby, nakadapa pa, no, nagakamang pa, ganyan. Okay? And then, by the end of first year, the legs are disproportionately short, okay? So, dili po nang kanang mubo dyan kay tiil ha. So, disproportionately short and bold. Ano bang ibig sabihin yan? Short and bold. Especially if, no, yung ating child is not yet able to walk. So, parang ganito pa yung magiging, tingnan nyo, disproportionately short and bold, no? Medyo, mura siya bow and arrow ba, na, di ba, ang kuan sa bow, no? Ang shape, ana, okay? So, ganyan. Okay? And that is perfectly normal, ha? Okay? Dili na siya kimpang yun, okay? You would not really know the shape of the, sa bana shape, bana siya, or ang iyahang kuan, appearance of the legs not until hawod na maglakaw si baby. So this time, no, especially kung nag-practice pa lang maglakad, dili pa kayo develop yung muscle. So ganito pa yung appearance ng kanyang legs. Nakuha? So yan, that's it for the height of our infant. Okay? Meron bang questions so far? By the way, yung ating weight and height, no, meron tayong growth chart if you are familiar with that or meron kayong mga pamangkin or kapatid, no, na infant, okay? Especially kung sa health center and even if sa clinics ng doctor, meron yan silang kanang murag baby book nila or booklet, okay? Sa likod, ana, or sa ba na nakabutang na page. So, na growth chart, no, na ay weight for age, weight for height, wherein, di ba, yung BMI, kung sa atin adults, no, BMI yung ginagamit natin to compare the weight and the height kung appropriate pa. Sa kanila is ganito, sa chart talaga. So, i-compare, for example, I think this is the weight, no, dito, one, or the age, ganyan, okay, and then dito yung height, and then, titingnan kung normal ba ang kanyang growth, anak, proportionate lang ba siya, okay, so, sige lang malaman, or mapag-aralan niya lang yan pagdating ng CHN o sa next semester. So, hindi na muna tayo mag-dwell more on that. Okay? But basically, meron tayong, dapat aware lang kayo no, na meron tayong growth chart na ginagamit natin sa ating children, okay? Below 5 years old. Okay? Kasi hindi sila ginagamitan ng competition ng BMI. Okay? Sige. So, of course, when compute na ninyo, no? So, automatic, very underweight na ang inyong babies. Okay? Sige. Next. Okay pa ba mo? Hello, guys. Naapa ba niya ako mga students di Ari? Hello? Hello? Sige daw, react daw. Ano nga, tulog na nino? Naapa. Okay, thank you. Sige. Okay? Next, let's move on to our head circumference. So, sa head circumference, ilan yung normal range natin for our head
33 to
circumference?
35, ma'am. 33 to 35.
Okay, very good, no? So, for our newborn, 33 to 35 centimeters. Okay, very good. Okay, with that, wait lang. Okay. So, 33 to 35, yes. Okay? So, here, no, yun yung ating newborn. So, of course, lumalaki din siya as the child grows older because, bakit nga lumalaki yung ulo ng ating baby? To give way for the
Brain development.
Okay, very good. For the, to give way, no, ng ating brain development. So by the end of our first year, okay, the brain of our infant will reach 2/3 of an adult size. Okay, hindi pa siya yung adult size talaga, of course, no, kasi infant pa man. Okay, so but by the end of first year, 2/3 na siya, no, more than half na siya ng size ng adult brain. Okay, so that's why hindi pa siya fully developed na fully developed size na adult brain kasi nga, di ba? Or that's why hindi pa mag-close ang inyong fontanelles to give way kasi by the end of 1 year, lalaki pa, no? 2/3 pa man ang size sa brain, no? Compared sa adult size na brain. 2/3 pa ang size ng ating infant brain compared sa adult size na brain. That's why our fontanelles, no? Fontanelles ng ating infant hindi pa mag-close. Specifically, unsa to na fontanelle ang dili pa mag-close? Pag infancy, unsa mo i-expect na fontanelle na hindi mag-close? By the way, sige, what are the fontanelles nga? Sa ganitong fontanelle sa baby? You have two, diba? So what are those?
Posterior fontanelle at anterior fontanelle.
Okay, posterior, anterior, no? So anterior and your posterior na fontanelle. Saan ba makita si anterior fontanelle?
Sa frontal lobe.
Sa front, okay, dito banda. So kung nandito yung ating baby yan, ano yung shape again ng ating anterior fontanelle?
Diamond po, ma'am.
Diamond shape. Very good. So it is larger than our posterior fontanelle. So posterior naman, ano yung kanyang shape?
Triangle po.
Triangle. Okay, ganyan. Okay? So between the two, ano yung first na mag-close? Or ano yung i-expect natin na still open pag infancy stage? Meron pa bang open na fontanelle or close na?
Anterior ang pinaka-last at ang mag-close mo.
Okay, ang anterior ang pinaka-last mag-close, kailan siya mag-close? Kailan yung closure ng ating anterior fontanelle?
12 to 18 months, ma'am.
Very good. 12 to 18 months. How about the posterior? Kailan yung closure ng posterior fontanelle?
1 to 2 months, ma'am.
1 to 2 months? Higher pa. Kulang ng Okay, meron tayong answer dito. Very good, no? So 1 to 2 months, we have 2 to 3 months. Okay? So with this, no, kasi mas maliit yung ating posterior fontanelle than our anterior fontanelle. So si posterior, mas earlier siya mag-close than the anterior. So si anterior na yung mag-continue, no, ng brain, okay? Or mag-support ng brain development na hindi pa niya i-allow na mag-close pa yung ating fontanelle. Okay? Very good. So, by 1 year old, no, during the infancy stage, you can expect na, pwede close na, okay, exactly 12 months, or pwedeng open pa, okay? Kasi ang maximum natin, 18 months na mag-close yung ating anterior fontanelle. Very good, okay? Next, asymmetric, no? Pwedeng maging asymmetric. When you say asymmetric, what is that?
Not equal po.
Okay, not equal yung appearance ng ating skull, ng ulo ng baby. Bakit, ma'am? Pwede siya due to one sleeping position causing the skull bones to flatten on that side. Okay? For example, di ba, kakita na ba mo anad mga yung anak na baby? Okay? So, for example, ang ulo ni baby, no, instead na ganyan, okay, instead na ganito, ma-flat siya kanang flat head, no, mapihi. Okay? That is because common na phenomena, especially kinakakita na gid sila, especially if si baby is or tends to sleep in one position only. That's why sa NICU, no, kung ma-observe or kung maka-observe na ka later on kung mag-duty na, gina-turn na sila to sides. Kung na ay mga kanang babies na nakakuan sa NICU, so gina-turn sila, gina-turn. Okay? And kung naka-sideways, kasi very important na kung iiwan nyo si baby or for example, matulog mo at night, no? So, kung makatulog po mo at night, very safe na position kay baby kay so fine, of course. Kasi kung naka-sideways siya, no, hindi natin kung for example, kung makatulog, ang parents, okay? So, and then nakatagilid lang ang, nakatagilid lang ang baby, di na tumamalay na basig makulob na dahil siya. And remember, di pa kayo na malihok sa baby ang iyahang head, okay? So, merong danger of suffocation, no? Meron tayong sudden infant death syndrome, tingala ka la, wala nagahinga, pag mata mo sa buntag, wala nagahinga ang baby, kaya natabunan dahil siya dito sa unla, no? Di niya ma-move, kaya nakatagilid man, okay? So, with that, very safe pa rin yung sleeping position na supine kapag nighttime, pero during the day, so pwede siya, pero pag merong close na supervision, okay, so pwede siya side lying, okay? But anyway, that is only, no, kanang yung sleeping, yung flat head, okay, mawala siya kapag maghinay-hinay siya o kawala, no, yung deformity niya, mahinay-hinay siya kawala, especially if mag-tummy time na yung ating baby. Are you familiar with the tummy time? Ha? Di naga-change ng naga-change ng position, no, ganon. Kaya mag-deform yung ulo ng baby, okay? Ma'am, mabalik pa na sa dati kung pihing. Kung pihing ang bata and then kanang ano pa siya, less than 3 months old, mga ganyan, okay? 2 months pa lang, 1 month old pa lang, okay? Mapihing siya. Yun nga, maka-help yung tummy time, okay? For example, mga pilhaw, 1 month pa lang siya ganyan. Then, hindi na bonnet pa na, di ba? Aside from the hypothermia, na kanang preventing hypothermia, your bonnet can say tawag na to, can support the shape of the head ng baby, okay? So, with that, no, hindi lang na enough na mag-bonnet, kasi kung mag-bonnet, o niya higda gihapon siya, sige gihapon higda, so mura gihapon, ma-deform ra gihapon, okay? So, with that, ang makatulong talaga is the tummy time. Unsa man ang tummy time, kanang mag-spend good si baby og how many minutes lang, very short, no? Or habang lumalaki siya, nag-increase din ang time ng kanyang tummy time. So, man na, kanang nakadapa si baby, no? Spending time with his or her tummy. So, nakaingani ang position. Nakuha ba? Okay, so nga na lang, tummy time. Tummy time meaning, no, naka-kulob, yes, naka-prone position yung ating baby, okay? But with this, especially kung wala pa masyadong head control, very delicate, no, very dangerous pag tummy time mo si baby doon sa mattress. So kung dito, mattress na ka ng sahigdaanan, nasa bed, okay? So kung dito sa bed siya mag-tummy time, okay, dapat close supervision ka, kasi maana na siya dito, no, kulob siya dito yung ulo sa bed, di nakahingan, no, kaya di pa man niya kayo maalas sa iyahang head, okay? So much better, pwede mag-tummy time yung ating baby dito sa chest ng ating mother, okay? So mag-ana si mother, mag-reclining position, and then di rin niya ibutang ang diri niya yung anak si baby, okay? And then, hayaan lang si baby na iasa-asa niya yung ulo. So, yun na yung tummy time, okay? Especially pag 1 to 3 months old pa, yung wala pa masyadong head control, okay? Sige, so with that, no? And, for example, yung kapag siginaw, tummy time, and samot na, kung medyo dako-dako na si baby, okay? Kung mag-persist gihapon, iyahang asymmetric or kato iyahang flat head, okay? Kung nalang gihapon, okay? Ibig sabihin, no? Kulang, no, lacking yung kanyang stimulation. So, may stimulation katong akong ginaingon na tummy time, okay? Lacking ang iyahang activity, or the infant is not receiving enough na kanang, or not spending enough time na mag-tummy time siya, or kanang spending too much time na nakahiga. That's why mag-continuously na flat. So, kung flat na yun na siya, especially kung more than 3 months old na, okay? Ma'am, wait lang. Nag-recollection ang tomorrow. So, 2E lang ang may recollection tomorrow. The 2F, wala. OMG. Okay. Kailan nga yung, sige, anya na lang nato na hisgutan. I-remind ako later, ha? Okay. So, again, okay, o sana ta? So, again, kapag still persist yung ating flat head, no, yung asymmetry, yung pagiging flat ang head ng baby, ibig sabihin, the baby is not spending enough time, no, or spending too much time na nakahiga, okay? So, with that, especially pag more than 3 months old na yung ating baby, okay, samot na kung nag-close na yun ang fontanelle, so dili na yun siya. Forever na siya na yung ana ang shape sa ulo ng baby, okay? Sige. Nakuha ba? Or meron tayong questions? Eh? Anong effect yan? Wala naman siya. Wala. Sa brain development, no. Wala siyang effect, no? So, yun para hindi niya mahinder yung brain development, but more on aesthetic na lang, no? Aesthetic, okay? So, yun lang. Ang appearance lang is kanang flat siya, but wala siyang evidences na meron siyang effect sa brain development. So, nag-grow man gihapon ang brain inside, no? Kaya open pa man ang fontanelle. Okay, not unless kung abnormal na mag-close na kanang without the designated time pa. So, normal yung brain development pa rin. So, yung appearance lang talaga, no, ng skull, okay, ng shape, the shape of the skull is different, okay? So, appear na flat siya, pero wala siyang effect sa brain development. Okay? So, meron pa tayong, question? Okay, I think wala ng questions, no? So, we can now move on to your body proportion. So, yung body proportion, no, yung growth ng yung growth, no, ng extremities ng ating baby, okay? So, with this, no, changes from newborn to a typical infant appearance. So, newborn, di ba, baby pa kaayo, okay? So, dramatic masyado yung change, no, matingala ka, murag ko, dali, itubo sa ko ang baby. O, so, yung ang growth during infancy, okay? But the moment, no, murag bag-ura, manigian na, kunya, karon kay ani na yung itsura. So, ganun yung changes na nangyayari kapag infant, okay? Next, kapag 1 year old, mag-appear na yung kanyang lower jaw, no? Magiging prominent na ang kanyang lower jaw. So, kung doon sa newborn, no, di pa kayo mo mahalata, asa man ang liog ani sa akong baby, asa man iyang jaw, okay? Fancy, especially, no, by 1 year old, okay? Mahalata na yun ninyo, no, na liog ang ato ang baby, makita na siya, okay? Prominent na yung kanyang jaw, okay? Next, the chest circumference is still, no, less than the head circumference by 2 centimeters. Bakit? Ano pala sa newborn stage? Mas malaki ba dapat yung chest sa newborn stage? Ano dapat yung pinakamalaking body part?
Head po, ma'am.
Head pa rin. Very good. So, just the same, no? Yung ating chest circumference during infancy, mas malaki pa rin yung ating head compared to the chest because of, yun? Pero maghinay-hinay na siya og kuan ka, proportionate, okay? So, because of, bakit mas malaki pa rin ng head during infancy? By 1 year old, malaki pa rin
Developing
ang
pa
head
kasi siya.
because?
Nag-develop po kasi
Bakit
siya.
kaya? Okay. Very good. Nag-develop pa. Specifically okay, meron tayong answer dito. The brain development. Very good. Okay, nag-develop pa yung ating brain. Remember, no, 2/3 pa lang siya compared sa adult size. Okay? Kaya, hindi pa siya, basically, no, mas malaki pa talaga yung ulo compared to the body, okay, or the chest. Next, the abdomen remains protuberant. So, manang protuberant, mura siyang nagbutod, no? For example, this is the ulo ng baby, the neck, okay, anang ulo, neck. Kung yung likod sa baby, chest, okay, medyo protuberant. Ana pang abdomen sa inyong infant, okay? Because here, no, protuberant pa siya because the gastrointestinal muscles cannot support yet the organs, no? Medyo mabugatan, no? Hindi pa fully develop yung organs. I mean the muscles doon sa abdomen, okay? Hindi pa niya mas fully support, kaya mag-protrude or no? Kanang murag mabugatan pa ang muscles na sa gastrointestinal muscles ng baby doon sa kanyang remember, daghan ba kay tag organ sa abdomen, no? So murag mabugatan pa yung muscles ana. So di pa kayo ma-hold, okay? That's why mag-appear na protuberant. Pero that's okay. That's perfectly normal. Next, okay? Not unless na lang kung ingani protuberant tapos kapag hikap niyo mo extender, no, kanang sakitan ang baby pag hikapo, nga na, or lahi na yung color, maging na redness, okay? Na rashes, of course, that is already unusual, okay? Pero pag ang shape lang, no, is protuberant, medyo butod ang tiyan, okay? So that is normal lang. Next, the cervical, the thoracic, and lumbar vertebral curves develop. Okay? Unsa man ang dili niya sa cervical na cervix, sa cervical ni siya na anatomical name for anatomical name for what? Yung ating cervical dito na tinutukoy.
Yung neck part po.
Okay, very good. The neck part, 'di ba? Remember, no, yung ating vertebral column, 'di ba? C7, 'di ba? Ma-remember pa rin yung cervical, lumbar, thoracic, and then cervical, thoracic, and then the lumbar, and then sacrum coccyx. So, yan, vertebral column in general. Okay? So, with this, no, kasi the newborn, ano ba ang shape ng vertebral column ng newborn? That is the C shape pa. So, for example, this is the head, pa-curve, paana pa iyahang shape, no? Kanyang taking into, kanyang kumbaga nasanay sa kanyang position during the kanang katong napa siya dito sa loob ng womb. Okay? But then during infancy dito na no mag-develop na yung so instead na C-shape dito na ma-develop katong curves. Okay? So meron ng curves dito sa neck, meron ng curves dito sa thorax, no, and then the lumbar area. Okay, nakuha ang difference. So kung C-shape during the newborn, again sa ating infancy, mas prominent na yung curves of the body, okay? Or the spine, or the vertebral column basically. Next, lengthening of the lower extremities during the last 6 months. As we have mentioned no dito sa ating height, okay? Yung ating first 6 months, ang lengthening or the growth of the trunk, no, yung upper extremities, okay, but by the end of the first year or during the second 6 months, doon naman ang prominent na growth sa legs ng ating baby, especially kung nagatindog-tindog na siya, no, nag-bear na ng weight sa kanyang body, okay? Sige. Questions? Okay, so body proportions or the body growth, no? Let's talk about, wala na gihapon ako na insert. Well, anyway, so let's talk about first, before your gastrointestinal system, we are going to talk about first your cardiovascular system. Okay, cardiovascular muna. Okay, when you say cardiovascular, of course, no, inyong heart, blood vessels. Okay, ano ang i-assess natin dito sa cardiovascular? Kapag nag-newborn care, sige, very specific, kapag nag-newborn care, anong i-assess po dito na vital sign sa cardiovascular system?
CR and RR po, ma'am.
Okay, the CR. Okay, RR is, pwede po, no, kay kanang circulation man, but more on the respiratory yung ating RR. So basically, so one vital sign sa ating cardiovascular is the CR. Very good. Okay, the cardiac rate. For our newborn, ilan yung ating normal range ng ilan yung normal range ng cardiac rate for the newborn?
120 to 160.
Okay, no, very advantageous to mga naka-RD na og newborn care. Very good. 120 to 160 beats per minute. Okay, that is the normal range for the newborn's heart rate. Okay, o sa mani, I joke. Nag-joke ko yun. Okay lang nga. Sige, okay. Nag-chat dire. Okay, very good. Correct. 120 to 160. Okay? Since, no, bakit masyadong mabilis? Kasi the heart of your newborn, diba, is still immature and it's still maliit pa. Okay? So, para ma-circulate niya faster yung blood, okay? So, since maliit pa man siya, so with that, ang chambers din ng heart is maliit. So, ang magkasya lang na dugo is also maliit. That's why para ma-circulate siya faster, no, maapas o circulate sa body, so fast po diya ang heartbeat, okay? So, as the baby grows, okay? Wait lang. Nag-choppy ko. Nag-choppy ba ako? Internet connection is unstable. Madunggan lang. Marinig lang. Hello, guys. Madunggan ba? Wala siguro.
Rinig po, ma'am.
Marinig lang. Okay, thank you. So again, no, since ang newborn's heart is still immature, medyo maliit pa yung kanyang shape. So with that, kapag maliit pa yung heart, maliit pa yung chambers, so maliit lang din na amount of blood yung magkasya, okay, each pump, okay? So with that, kailangan maraming pump yung kanyang gagawin para ma-circulate, no, properly yung blood. Okay? Kasi nga maliit lang man na magkasya sa chambers. But as the baby grows older, no, yung newborn natin na lumalaki din ang kanyang organs, of course, including the heart. So with that, kapag lumalaki yung heart, no, lumalaki na din yung chamber, so mas marami na din yung blood na nagkakasya doon sa chamber. So with that, noon sa kaya ang heart rate natin is naga-fast as we grow older or naga-slow?
Slow po, ma'am.
Yes, very good. Naga-slow down kasi each, no, for example, kung i-compare natin sa adult, diba, each pump, marami naman, no, since malaki na yung kanyang heart, malaki na din yung, malaki na din yung amount of blood na magkasya through each pump. Okay? That's why habang nagapump, naga-slow down na yung pumping ng ating heart, yung heart. So lumalaki yung heart, nagsa-slow down din yung pumping of the heart. Okay? Kasi nga malaki na yung amount of blood na nagkakasya through each pump. Okay? So with this, Okay? Yung ating newborn is still 120 to 160, but ang ating infant, no, specifically by the end of 1 year, we have approximately yung normal range natin would be 100 to 120 beats per minute na lang. Okay, so kung i-compare mo siya, 120 to 160, of course, kung ingani gihapon ang heartbeat sa imong baby niya, infant na siya, ipa-check up, no, tachycardic ang ato ang baby. So, dapat mas lesser na. Okay? Kasi again, the heart, kung i-compare mo yung size ng heart ng infant, the size of heart of the infant compared to the size of the heart of the newborn, of course, mas malaki na yung heart ng infant, mas marami nang magkakasya na dugo doon sa chambers, okay? So, mas marami ng dugo yung mapapump through each pump. That's why magsa-slow down na siya, okay? Nakuha? So, with this, okay, yung BP naman ng ating infant is approximately 100 over 60, tama, mmHg. Okay, infant ha, okay, yan siya. And then, typically, magkaroon ang ating infant ng physiologic anemia. Since, okay, again, yung sino nga nag-produce ng RBCs, yung bone marrow. So, yung bone marrow natin is not yet producing adequate amounts of RBC. That's why magkaroon ng physiologic anemia. Yung physiologic anemia, somewhat expected. So, it is easily corrected through your vitamins. No? That's why nag-vitamins ang ato ang baby, okay? Or from the breastfeeding no, sa mother, okay? So, that's why nag-vitamins ang ato ang baby para makorect if ever merong physiologic anemia. Okay, yung sama ng physiologic anemia, anemia is less, di ba, ang RBC or yung hemoglobin doon sa blood. Okay? Bakit? Okay, usually yung physiologic anemia mag-appear siya within 2 to 3 months. Bakit? Kasi, again, ang ginaproduce ng bone marrow na RBC is inadequate as well as yung kanyang lifespan is not the same as with the adult. So, yung adult lifespan ng ating RBC is 120 days. Tama ba? So, that is approximately 120 divided by pila ba ni? Saan man ipag-divide para mahimong months? Divided by 4? Tama ba ko? So, approximately 3 months. With that, no, so pwedeng less than 3, no, mag-burst na itong mga RBCs, dali lang sila mamatay, di sila mag-abot ng 120 days. That's why, no, makulangan yung RBC. Aside from that, hindi pa rin adequate yung na-produce ng bone marrow, and that is completely normal. So with that, no, kailangan ng support with the vitamins if prescribed siya ni doctor. That is during 2 to 3 months. But pag-abot ng infant ng 5 to 6 months, okay, produce the same na yung adult na RBC. Okay, yung 120 days na lifespan. And yung ating RBC is already adequately produced by 5 to 6 months old yung ating infant. Nakuha? Okay? So, kapag magkaroon pa ng anemia during 5 to 6 months old or 6 months old and older, okay, hindi na siya physiologic anemia. Okay? Baka meron ng underlying cause nga na magka-anemic man gihapon, no? Or maybe the baby is not eating well, maing anak. Okay? Or the baby is not feeding well, ganyan. Okay? Nakuha? So, adequately produced na siya and yung lifespan is just like an adult RBC pag abot ng 5 to 6 months old. Okay? Yan yung for the highlights, no? Yung important na development ng cardiovascular system. Okay? Are we clear? Okay ba tayo, guys? Na-understand yung cardiovascular? Wala ni sa ano ha? Kaya sinusulat ko siya. I hope nakikinig. Okay, sige. I will erase this one kasi hindi ko pa din pala ni-insert. Yung respiratory system. So, wag muna itong gastrointestinal. Okay? Respi muna tayo. So, sa respiratory system, okay, ilan nga yung normal range for our newborn na
40 to
RR?
60 ba? Ma'am?
Very good. So, 40 to 60 cycles per minute. Okay, again. So, as the child grows older, again, nagmamature ang kanyang lungs, lumalaki ang lungs, so mas marami na ding air ang ma-accommodate, okay, or ang ma-oxygenate. So, with that, magsa-slow down na din yung kanyang RR, okay? So, with this, ang infant na RR should be, or ang range ng infant ng RR from 40 to 60 sa newborn, magiging 20 to 30 cycles per minute na lang. Nakuha? So, kung more than 30 ang infant, then more than 30 ihang RR, okay, no? Nahimong 60 ihang RR. So, of course, you are going to refer, no, kay abnormal finding na siya kapag infant ang inyong patient. So, dapat, ang normal range is 20 to 30 cycles per minute. That's by the end, no? By the end of your first year or your infancy. Okay? So, habang lumalaki, nagle-lessen na yung RR ng ating, or yung, yes, the respiratory rate of our baby. Okay? So, with this, no, but then, even if nagmamature, okay, still, no, yung ating infant has small lumen, no, small pa rin yung medyo opening, small pa ang lumens, no, dito. Ay, di man ni ko andi ay subit. For example, dito, no, di naman na diri ang lungs, okay? Yung opening, no, yung trachea, yung bronchos, okay, mga bronchi ng ating baby, that the lumens are still small. Okay, aside from that, no, yung infant natin has, insufficient, okay, or inefficient pa, insufficient na lang, insufficient production of mucus, okay? Which is, no, yung mucus natin, it will help in the expectoration or in the, pagpapalabas niya ng pathogens, di ba? Kung naay pathogen na makasulod, okay, automatic mag-ubo-ubo, okay? Pag hindi pa enough mag-produce, no, one of the mechanisms of the body is to produce mucus para easier siya or ma-block ang airway and then easier siya ilabas, okay? Yung masali doon sa mucus yung pathogen, okay? That's why yung ating infant is prone to respiratory. Pag magkaroon sila ng respiratory infection, mas dali silang mag-complicate. Kasi nga, yung lumens nila are small. Aside from that, meron pang insufficient production of mucus, okay? So with that, mag-produce siya ng mucus but it is not enough and then hindi din sila marunong mag-expectorate or hindi nila effectively ma-cough out, no, yung pathogen, okay? That's why, so basically, no production of mucus. Kung maliit lang ang mucus, hindi matrap doon yung ating pathogen, so makapasok sila deeper inside the respiratory system of our baby. So, mas mag-complicate yung respiratory infection. Okay? That's why, kung simple ubo lang, no, dili pa dugay yun. Okay? Kapag ginaubo si baby, samot na kung infant, no, less than 1 year old, okay? Infancy stage, pag ubuhon, automatic, no, i-add to. Dili nang paimnon, magbot-bot, og inom mong tambal, magpa-antibiotic, no, okay? So, check up, no, if needed ba? Kasi sometimes, viral infection lang. So, when you say viral infection, self-limiting, no? When you say self-limiting, mawala lang siya on its own. Okay? Usually, nga naman ng mga viral na kuan infection, mawala lang on its own without any treatment. Okay? Yung immune system lang ang nag-fight. Okay? Supportive lang tayo. Ang gagawin na medication, ang gagamitin na medication is to counteract the symptoms. Hindi yung unlike kung bacterial, no, so doon na mag-come in yung antibiotics, okay? That's why kapag mag-ubo or magkasakit yung ating baby, you know, ang bata, dapat isubmit talaga through check-up para ma-properly diagnose kung ano yung sakit niya. Bacterial ba? So, unsa man ang pagkabalo kung bacteria, saan kaya yan siya makita? Through saan ginatest sa inyo pagkalinturahon mo, pag na-ay may something na ano kaya yung very common na laboratory test? Tingnan ko lang kung alam nyo ba. Na very common na laboratory test for you to know if it is viral or sa bani bacteria, no, na nabay bacterial infection ng atuang patient. Unsa kaya ang i-order ni doktor na laboratory test? Okay, very good. Nag-answer diri CBC, no? Complete blood count. Okay, so doon makikita, no, lymphocytes, no, yung white blood cells. Kung taas gani, ibig sabihin na merong bacterial infection. Okay, so meron din tayong different types of, so meron din tayong different types of infection sa WBC. Pwede din sa stool. Okay, sa stool naman, kung ang complaint ng ating baby or ang ating child is kanang sakit yung tiyan or naga-diarrhea, okay, so yan, pwede sa stool, okay? Or merong blood in the stool, so of course, yung stool, yung ating specimen, okay? Kapag blood culture naman, so Pwede din blood culture, pero kapag wala kang nakita sa CBC, kasi usually CBC sa pinakadali, no, dali lang kayo makuha ang result, okay? So, within 1 hour, after 30 minutes to 1 hour, nanaday ng result. Ang culture kasi, so when you say culture, pag-grow pa yung bacteria. So, titingnan, okay? So, doon sa specimen, blood culture, so basically blood, okay? So, titingnan doon sa blood, no, sa petri dish, diba? So, titingnan kung meron bang magtubo na bacteria doon, okay? So, it would take 3 to 5 days or depende, no, na sometimes no 1 week ganyan, okay? Hihintayin kung meron bang magtubo na bacteria, okay? So same as with your stool culture. So iba si stool exam, iba din si stool culture. Si stool culture, titing yung specimen, no, ilalagyan sa petri dish, ne, and then allow na mag-grow yung mga normal flora so na mag-grow dira, okay? Kung naaga ni mag-grow or naaga ni magkuan, yes, na mag-grow na bacteria, ibig sabihin agoy, okay? Na ay infection ang ating simbako pod palayo, okay? So merong infection kapag mag-grow. Kasi usually, that's why 3 to 5 days. Kasi after 3 days, kung walang mag-grow, okay, stay pa na nila, no, i-extend nila to 5 days, okay? So, kung kapag after 3 days na ganit na yung mag-grow, so, pwede makuha na ninyo inyong result, no, si bako lang po, okay? So, pag makuha gani siya, pag makuha ang result o after 3 days, ibig sabihin merong nakita, no, na dayo nag-grow. Pero kung wala pa yung nag-grow, after 3 days, 5 days yan nila, okay? Just to be sure na wala talagang mag-grow after 5 days, okay? Sige, yan yung mga culture natin. You will allow na merong mag-grow, and then kapag walang mag-grow, of course, walang infection. Next, asa na tayo? So, respy, I think yun lang ang importante sa respy. Yun lang importante sa respy, no? So, we have to be very vigilant kapag nagkaroon ng respiratory infection. So, of course, dili lang ipawalang bahala na, ay, maayuran ng ubo. Okay? Again, very dangerous siya, especially kung less than 1 year old, no? So, pwede siyang mag-complicate. Dali lang siya mag-complicate. Okay? Nakuha ba? So, I think, sige lang. Okay. Nakuha ba yon siya? Hello? Okay ba tayo, guys? Okay. Sige, next. We'll proceed with your gastrointestinal system. Okay? Sa gastrointestinal system, okay, humanon lang nato ning growth na ano ha. So sa gastrointestinal system naman, okay, amylase for digestion is present, no, at 3 months old pa. When you say amylase, no, that is the enzyme which will help in the digestion of carbohydrates, okay? So, carbohydrates, ito yung enzyme responsible for the digestion of carbohydrates. So, with that, no, meron bang carbohydrate content yung breast milk? Meron ba? Okay, with that lesser, no, again, that's why breast milk really is best for babies because yung formulation niya is suitable for a stomach ng ating infant, okay? Or ng ating, yes, no, diba? Exclusively breastfeed your baby for 1 to 6 months, okay? Yan yung ating health teachings, no? Kasi yung formulation ng breast milk is the natural, di ba? So, very, very suitable siya for a stomach ng ating infant, okay? Dili siya magkaroon ng allergies, dili siya magkaroon ng kanang GI upset, no? Di magsakit ang tiyan sa tong baby kasi nga, no, ang mga, kasi, habang nag-develop pa yung stomach ng ating baby, nag-form pa yung mga enzymes, no, na pangtunaw ng ganito, pangtunaw ng ganyan. So, for example, here, no, ang amylase, ma-develop pa siya at 3 months. So, kung pakainin mo ng kanin ang ating baby, no, 1 cup of rice, ipahurot mo sa iya, matulon niya, okay? Okay ra, matulon, okay? Wala tayo problems with the aspiration. But then, pag nanadiri sa stomach, agoy, no, puno og kanon ang ato ang kuan, ang stomach ng baby. So with that, again, kapag less than 3 months nung they lack amylase. So with that, magsakit ang tiyan sa iyong baby, dili matunawan. Okay? Masakit ang tiyan. So another problem na naman. Okay? Mahirapan og tunaw yung stomach ng baby since there are enzymes na hindi pa present during that time. Nakuha? That's why, no, yan yung i-explain natin sa ating mga mothers, no, sa ating patients, sa parents ng ating babies, no, na kaya importante na hindi pa talaga siya pakainin earlier than 6 months, okay? So, ano lang talaga, milk lang talaga, okay? Sige, next. We also have yung ating lipase for digestion of saturated fat decreases. So, yung lipase, normally yung lipase is increased muna siya kapag newborn. But then habang nag-develop or sitawag na to grow, no, nag-mature yung stomach, nagdi-decrease na siya. Kasi in an adult, no, kapag adult na, normally, very few lang ng lipase, very few, okay? Small amounts lang ng lipase ang present, okay? Kasi what will happen, ma'am, no, asa man ang lipase, dito na siya, no, digestive enzyme siya doon sa pancreas, okay? Have you heard of your pancreatitis? Narinig nyo na ba yan siya, na condition, yung pancreatitis? Okay? So, yan yung basically one of the enzymes na responsible for digestion. Okay? So, lipase, kaya small amounts lang siya, especially doon no, sa pancreas. Kasi, kapag mag-increase ang lipase, increase yung digestive enzymes, magkaroon ng pancreatitis. Okay? Very common sa male, no? Hello guys, na ba mo? Opo, narinig natin si pancreatitis, okay? So, kadungog na ba mo sa phenomena o sa kondisyon na giurom? Kadungog na ba mo na giurom? That is, meron tayong tinuod na siya ha, pwedeng urumon. I do not know kung nagadamgo bagyod na ang person, ana. But then, what happens sa body physiologically is pancreatitis, okay? So, very increase yung digestive enzymes in which yung pancreas, no? So, sobra kataas sa lipase or sobra kataas sa digestive enzymes, yung pancreas natin, gina-digest niya ang kanyang sarili. And remember, pancreas is one of our, di ba, nag-regulate ang hormones, no? So, sleep-wake cycle, nga na. So, marami di lang tayo mag-discuss thoroughly, no? Kaya ma-discuss na ninyo soon when pag-abot sa inyong med-surg or ang saban na siya na rotation. But anyway, okay? So, with that, no, kapag gina-digest niya yung cells, so yun na, okay? Di na mumata si patient, ganun. So, it can cause death, okay? That is your pancreatitis. That's why lipase normally, very small amounts lang yung present. Just enough para to help, no, digest, no, sa food, okay? Pero dili siya, usay tawag na to, pero dili siya kanang in very big amounts. That's why meron talaga siyang connection na kanang matulog na busog kasi your body will tend to kanang produce increase, no, na kuan kapag busog. So since wala ka na may laing activity, okay, so that's why madirect gud siya nung mas mudaghan og produce kapag tulog ka unya busog pa. But not all ha, dili tanan, okay? Meron pa yun siyang underlying condition bakit magkaroon ng pancreatitis, okay? Sige. So, dapat, no, very safe, na unya na lang din matulog pag medyo tunaw-tunaw na, no, yung content doon sa stomach, okay? Sige. And then, so again, no, during infancy, nag-decrease na yung amount ng lipase. But, the liver is still immature, okay? So, although, no, yung liver is normally functioning na siya, pero it cannot conjugate pa maraming bilirubin, okay? Sige. So, di ba, conjugated bilirubin, unconjugated bilirubin. So, para ma-reduce yung bilirubin sa body, kailangan ma-conjugate mo na siya. So, it is, no, fully functioning na pagdating, or hindi pa siya kayo fully functioning, but then, dili na dapat siya mag-build up dito sa blood, no? That's why, di ba, magkaroon ka ng jaundice, physiologic jaundice, okay, after 24 hours after birth because of the very immature na liver, okay? Okay, so mag-build up yung bilirubin, no? Bilirubin doon sa bloodstream, kaya mag-yellow yung ating patient after 24 hours. But then, during infancy, dapat wala na jaundice, no? The liver is mature enough, okay, para malabas yung bilirubin, okay? But then, still immature kung i-compare mo siya sa adult liver. Nakuha? Okay, so yung immature na sinasabi dito is kung i-compare of course sa adult liver. So dili pa kay siya maka-filter out, no, ng maraming substances sa man imong ipakaon ana sa infant, okay? So magsakit lang na ihang tiyan kasi di pa niya ma-filter out since immature pa. But the bilirubin should ma-filter out na siya, okay, during the infancy. That's why di na siya mag-jaundice, okay? Mag-jaundice lang gid siya doon sa newborn stage. Nakuha? Are we clear? For our gastrointestinal system. So, yun lang mainly yung highlights, no, for our GI. Opo, okay, thank you. Next, let's proceed with your urinary system. So, sa urinary system naman, no, the kidneys are immature still, okay? and inefficient at eliminating body wastes. That's why, again, dili pa nimo pa kaunon yun, no? Ang intake lang yun sa ato ang baby should be breast milk, or kung dili makaya breast milk, formula milk. Kasi lesser yung wastes na ma-form niya. So, unlike sa atin na ginakain at daghan na kayo ng carbohydrates, ginagaon ko ng fats, na cholesterol, so oily substances, okay? So, daghan na po tag ma-build up na waste. So, with that, kapag yun yung ipakain mo during the infancy, okay, ganon, kapag less than 6 months, so, mag-build up ang waste and then mahirapan yung body ng baby na i-eliminate siya kasi nga immature pa, okay, during the infancy. Okay? So, dapat yung kanyang kinakain, yung sa feed niya is still unsa tawag nato ni kanang ano lang siya, appropriate for the functioning of the body ng ating baby. Okay? Okay, very good question. Going back sa ating gastrointestinal system, meron kasing question, ma'am, bakit nga po bawal magbigay ng water sa infant? So, pwede sila ma-water intoxication. Aside from that, meron kasing content yung water. Again, no? Kapag na-digest yung water, meron siyang mga kanang byproducts na hindi pa ma-eliminate sa sa body ng baby, since ang kidneys is mahirapan pa mag-filter out. Aside from that, ang liver mahirapan mag-filter out, and yung presence ng ating mga digestive enzymes, hindi pa siya, merong digestive enzymes na hindi pa present sa stomach that time. That's why kung painumin og tubig ang baby, matingala ka magsakit ang tiyan sa imuhang baby. Okay? So kung yung pang-timpla, ng pang-timpla o formula milk, ma'am, usually ang gina-recommend nila is just distilled water, kay very less yung kanang component dito sa distilled water, no, unlike the mineral water or purified water na daghan na siya components, kay kung masulod sa lawas is mag-produce siya ng mga other kanang byproducts, kay, and then mahirapan i-process sa stomach yung mineral unsa ba na siya purified water, digestive, kanang distilled water lang ang matolerate sa infant. Pero dili siya pure distilled water, ha, dapat with formula milk, okay? So dili pwede na water lang yun, no? Kapag nagainom o gatas, kapag ako lagi inom ko gatas, no? Kapag ikaw, okay lang ka, kay ma-process na sa imong stomach, but then no water talaga for the first 6 months, ha? Wala pa na intake ng water, okay? So, sa first 6 months, purely milk lang talaga, okay? Either, no, best yung ating breast milk, but kung dili pwede or kung wala gi breast milk, no, saan tama na, so yung formula milk, okay? Kapag nagka-formula milk for the first 6 months, not necessarily na paimnon og water after, okay? Yung formula milk is enough, okay? Na nato siya water content, nakuha? Okay, so yung formulation ng formula milk is enough na, no? Dili man siya as best as the breast milk, but it is the closer to the formulation ng breast milk, na enough na siya para ma-digest siya ng stomach ng ating baby. Okay? So, di na siya paimnon og tubig lang yun, ha, na purely water. Again, magsakit ang tiyan sa baby kung paimnon siya og tubig. Okay? Sige, so mag-water intoxication, and kung mag-water intoxication, no, again, mahirapan si baby na i-eliminate yung extra fluid kasi nga yung kidneys niya is still immature. Okay, so mag-accumulate ang water nung tingala ka, magbutod na ang tiyan sa imuhang baby. Okay? Sige. So, sakit. Of course, it is very painful for our child. Nakuha, ha? Kung na may mga pandira, kapamilya, no, na less than 6 months old, ayaw sa paim na tubig, okay? So, milk lang only. Either breast milk or formula milk. Okay? Sige. Next, no, talking about, no, going back sa ating urinary systems, yun nga, okay? Very immature pa yung kanilang kidney kung i-compare mo sa adult kidney. Okay? So, sa adult kidney, very, marami ng, or yung filtering capacity ng kidney is the maximum na. So, that's why, maski unsa ang imno, no, dili dayon masakit kay ma-filter out man sa kidney. So, kung i-abuse po, of course, dira na magkaroon ng sakit. Okay? So, with that, no, fully functioning na ang kidney during adult, but in your infant, no, dili pa. Okay? Next. Unable to concentrate urine not until 1.5 month old. So, manang concentrate urine, kanang di ba, unsang color sa concentrated na urine? When you say concentrated, masyado ang urine. Yes, no, very yellow masyado, okay? So with that, bakit, okay? So doon pa siya makakoncentrate ng urine at 1.5 month old kasi doon pa mag-mature yung kidney enough para makakoncentrate ng urine. And aside from that, doon pa mag-start, no, na yung bilirubin, okay? Bilirubin. Aside from sa stool siya, di ba? Usually sa stool siya masama. That's why ma-appear na yellowish yung stool, okay? So during 1.5 month old, yung bilirubin is not only sa stool lang ma-excrete, but since no mature enough na si kidney, so ma-excrete na din yung bilirubin through the urine. That's why mag-appear na yellowish yung urine because of the presence of bilirubin. Okay? Nakuha? So yun pa lang, no? By 1.5 month old and habang lumalaki, so nag-concentrate na po or na yung mga waste, no? Bilirubin is a waste product, okay? So yun pa lang yung primarily ma-filter out ng ating kidney. So more than that, okay? Kung sa ibang ipa-intake sa baby, okay? So with that, mahirapan ang body ng baby na i-eliminate, okay? Sige. Next. So sa endocrine system, no, it remains immature in response to the pituitary stimulation, okay? So immature siya, but mature na siya kung i-compare mo siya sa, mature na siya for an infant, but still immature yung kanyang functioning ng mga endocrine, okay? Of course, wala pa na ang hormones, no, dili pa na fully functioning to. That's why dili pa wala pa yung secondary sex characteristics, okay? Wala pa yung puberty, wala pang menstruation kasi nga dili pa fully mature ang endocrine system, okay? But of course, immature kung i-compare mo siya sa adult na endocrine system. That's basically it for our endocrine system, okay? Next, for our immune system, okay? So sa immune system naman, it is now functional, no, at 2 months old, okay? So at 2 months old, it can now produce your IgG and IgM. Are you familiar when you say IG, unsa man ang IG? IG means Instagram, char. IG means asa naman ako mga sulat? Very good. IG means immuno. Okay, immunoglobulin. When you say immunoglobulin, unsa man na sila? Immunoglobulin means? Unsa man na siya? Other term for immunoglobulin.
Antibodies po.
Antibodies, ma'am.
Very good. Your antibodies. Okay? In which, yung antibodies natin, so then, if we need magbasa terminal bus. Okay, di na ako na-concern. Sige, anyway, nasa na ta? So, antibodies, okay? So, that fights off your antigen. So, si antigen, pinsa man na sila. Kato sila tong mga invading, no, na pathogen, okay? So, kato sila yung foreign body sa invading pathogens, okay? So, with that specific antigen, okay, meron kang ma-form, yung body mo mag-form ng specific antibody. So, yung antibodies, yun yung ating mga immunoglobulin. So, there are very different immunoglobulins in the body, okay? So, you have, erase na ko ha, isa-isahin natin, review, IgG, IgM, what else?
IgA po.
Very good. IgA, unsa pa man? Basically, 5. GMA. Okay, 5. What else? IgA, yes. GMA, unsa pa man? GMA, IgG, IgM, IgA, unsa pa? 5 man sila. Okay, very good. IgD and so nahon ako ang kuan na lang. So, IG, very good. Okay, IgE and IgD. So, GMA and, okay? So, G, saan siya responsible? Yung IgG natin is responsible for, unsa man? Actually, this is the most common, no? Most common immunoglobulin in which responsible siya for your bacteria and or viruses. Okay? So, siya yung responsible for counteracting the bacteria and viruses. Next, your IgM naman is basically bacteria and viruses pa rin, no? But siya yung pinakaunang mag-respond, no? So, siya yung first line of defense. So, their defense. So, very abundant in your phagocytes. Okay? Next, so first line of defense, ang pinakaunang mag-respond na immunoglobulin kapag merong infection is the IgM. And then, i-stimulate na niya yung other immunoglobulins. O sa manita, nauna na to be? Dobe, uy, bacteria, okay, tawagon na ako si IgG. Kami nang duha maglaban, ani. Okay? Sa invading pathogen. Okay? Pag bacteria or virus, so ang si IgM, tawagon niya si IgG. Next, IgA is for what?
Respiratory tract.
Okay, very good. Respiratory tract or basically, no, siya yung responsible if merong invasion doon sa mucosal tissues. Okay? Kung sa maning present. Okay, yes. Presence, no, sa mucus. So, mucosal tissue, so siya yung nagsistimulate dyan. Uy, sa respiratory tract, okay. So, kapag ang infection gani, regardless kung bacteria or virus, so si IgM ang first line of defense. Okay, pag merong infection sa respiratory tract, sa mucosal tissue ng respi, so tawagon niya si IgA. Okay, so pwede po, no, in combination IgG, okay, kailangan namin additional kay bacteria atong ginalabanan, so tawagon po niya appeal si IgG. So pwede siya combination ha ng mga antibodies. Next, IgE is for what? For, very good, allergic reactions. Okay, so mga allergies, no, hindi na siya yung bacteria or viruses. Okay, so allergic reactions, si IgE yung responsible. And lastly, si IgD, ito yung ating B-cell, no, antigen or B-cell receptor. Okay, bakit? No, unsa man ang B-cell? So actually, your antibodies are all, no, B cells or B lymphocytes. Okay, so para, no, ma-stimulate, no, so kinsa gyud ang pinakauna? So actually si IgD. Okay, so para ma-stimulate yung formation of antibodies, okay, so merong kakabitan, no, so mo ni siya si IgD. Okay, ang kabitan. Okay, so si IgD, yung responsible for B-cell maturation, maintenance, and then B-cell activation. Okay? Okay. Okay. So, yan siya, ha, yung ating immunoglobulin. So, here, going back sa ating lesson, yung ating infancy, okay, ang present lang sa kanila is the IgG and the IgM by 1 year old. Okay, by the end of 1 year. That's why, no, very risky, no, at-risk population pa yung ating very young or yung ating mga infant because ang kanilang antibodies is less compared to an adult, no? Hindi pa present tanan ng antibodies. Okay? That's the beauty of your breast milk, 'di ba? Kasi yung breast milk natin, that's why I do not know kung you have ma-compare ba ninyo or mapansin ba ninyo, no, kung meron kayong kakilala. Okay? That's why mahirap ba? Mas madali magkasakit yung baby na formula fed compared sa baby na breastfed, no? Buyag lang yun. Kay, di ba, in your breast milk, pwede siyang magkaroon, yung ating baby, pwede magkaroon ng passive immunity. When say passive immunity, yung antibodies, no, from the mother, okay, pwede siyang mapass through the breast milk. Okay, so kapag merong passing of the antibodies, no, so magkakaroon, no, ng extra antibodies, no, pwede magkaroon ng IgA, IgD, IgE, yung ating infant na normally ang kanyang body ang gina-produce lang is the IgG and IgM. Okay, that's why mahirapan or di madaling magkasakit yung breastfed babies because again, yung antibodies ng mother is pwede siyang mapass through sa baby. So merong additional protection yung ating baby. So even if wala pa siya nag-produce ato na antibodies, since na-drink man niya, no, through the breast milk, so malalagyan siya ng antibodies from the antibodies ng mother. Nakuha? Okay? So yan lang din yung formula milk. I do not know kung nag-develop na ba silang formula milk na naing ana, but yan lang din yung disadvantage, no? Yan yung number one advantage ng breast milk. Okay? The presence of antibodies from the mother. Okay? Sige, next. Ability to adjust to cold matures by 6 months. Okay? So, ano nga yung mangyayari, no? Yung cold stress natin, kung ma-remember pa ninyo during the newborn, okay? Mag-shiver ba sila or hindi?
Hindi
Ating newborn, yes, no? Hindi sila mag-shiver, di ba? Ang kanila is mag-metabolize ng brown fats, okay? Para yun yung mag-produce ng heat sa body, okay? But now, okay, during infancy, as their brain matures, no, nag-mature din ang function. Okay, with that, mas effectively na nila ma-handle yung cold, okay? With this, okay, during 6 months, no, pwede na silang mapansin mo na mag-shiver yung ating infant, okay? So, they can now effectively counteract yung heat or body heat loss through shivering, okay? Ma-preserve na yung body heat through shivering, okay? Next, they develop additional adipose tissue for insulation. Kasi adipose tissue, basically, no, yung fats, okay? The baby fat. So, ma-develop additional, okay, tawag na to, kung i-compare mo yung lawas ng infant sa newborn, of course, mas malaki na yung lawas ng infant because aside from lumalaki na siya, mas marami na din ang kanyang adipose tissue. And aside from that, yung ating infant is yung ating newborn is mas madali siyang ginawin compared sa infant. So sa infant natin, mas effective na ang kanyang insulation rather, because of the presence of additional adipose tissue. Okay, yung subcutaneous na tissues natin. And then, the amount of brown fat, diba, if you can still remember, no, katong abundant kapag term baby na newborn, okay? So, it will decrease, no, as the baby grows older. Pero, yung subcutaneous, as the amount of brown fat is decreasing, mare-replace na siya with adipose, no, or your subcutaneous tissue. So, that is, of course, for insulation, okay? Sige, next. Extracellular fluid, this is very important. When you say extracellular fluid, yun yung fluid na outside the cell. So basically, katong blood plasma, again, basically lahat, no, ng fluid outside the cells of the baby, okay, sa body ng baby. So outside the mucosal tissue, outside, so basically sa blood plasma, no, na dito, 35, that is made up of 35% ng body weight ng ating baby. And then, ang intracellular fluid nila is 40% of the body weight. Okay? So, because of this one, it will increase now the susceptibility to dehydration. Bakit? Okay? Kung i-compare natin, last na lang ito, siguro. No? Okay, sige. Immune system na ang last natin. Okay? And then, tomorrow, yung the rest. So, kung i-compare natin, we have here, asan na ta? Infant, okay? Infant, no, ratio, no, ng infant and the adult na extracellular and intracellular fluid. Again, extracellular, yun yung fluid outside the cell. Intracellular fluid inside the cell. So, kung yung intra, no, ang nasa intra, mahirap siyang i-lose kasi nasa sulod man siya sa cell. Sulod sa RBC, sulod sa WBC, sulod sa cells in the GI lining, sulod sa mucosal cells, nasa loob. So, mahirap siyang i-lose. Okay? Yung madali na i-lose, yung extracellular fluid, yung blood plasma, okay, lahat ng nasa blood vessels na fluid, no, extracellular, madali siyang i-lose. Paano siya ma-lose? Through watery stool, kapag nag-diarrhea. Paano pa? Through sweat, nga na. So, but most commonly through the diarrhea, okay? So, di ba, kapag nag-diarrhea, watery stool, fluid man yung i-discharge ng body. So with that, yan yung extracellular fluid. Okay? So remember, ang composition ito composition ng extra to intracellular ratio. Ratio ito ng composition ng extra to intracellular fluid. Sa ating infant, no, ng 35% ng kanyang body weight is extracellular fluid, while ang intracellular naman is 40% ng kanyang body weight. While pagdating naman sa ating adults, no, only 20% lang ng kanyang body weight ang extracellular fluid, while malaki din, mas malaki na percentage yung intracellular fluid. Yung sa ating infant, halos equal lang silang dalawa. So with this, no, mas marami yung composition. Nakuha ba? Yung composition ng body weight ng infant, mas marami siya na extracellular kung i-compare mo siya sa adult. Okay? So kapag nag-dehydrate yung ating adult, mas dali lang siyang ma-resuscitate. Okay? Yung ma-reimburse, tawag na, ma-replace, no, yung kanyang fluid loss. Okay? Mas dali siyang ma-replace since, again, 20% lang man, dili kaayo grabe yung mangyari sa ating adult. Although pwede gihapon siya mo grabe, but hindi siya ganun kapaspas mo grabe because 20% only of the body weight is the extracellular fluid. While yung ating infant, again, remember, 35% of the body weight is extracellular fluid. So, kung mawala yan siya, okay, dali lang kayo mabawasan og weight ang inyong infant. So, they are more susceptible to dehydration. Nakuha ba kung anong mas delikado ma-dehydrate yung ating infant? Okay, so kapag mag-dehydrate sila, no, mas mahirap siyang i-replace, no, mas maglisod tag-replace, no, dali lang kaayo sila mas severely dehydrate because of this one, no, ang component ng extracellular fluid nila is mas marami compared to an adult. Nakuha ba? Okay, so hindi natin hayaan ma-dehydrate yung ating infants. Okay, that's why, no, di na health teachings yun ng doctor. Samot na kung ang ilahang complaint is diarrhea. Okay, so ma'am, once gani mag more than 3 times na siya magsigi og libang yun, no, ng watery, very watery na stool, more than 3 times, mag-admit na tama. Di na to, dili na siya i-manage sa balay, i-admit na to na siya because of the effects, no, dali lang, again, madali lang ma-dehydrate yung ating infant. So, better, sa tawag na to ni? The earlier management, the better. Okay? So, hindi natin paabutin na late, no, na magkaroon ng severe dehydration kasi kapag severe na, again, mahirapan na tayong mag-replace ng fluids and with that, no, it could cause the death of an infant. Okay? Nakuha ba? So, kung na-lose na nila ang 35, asa pa man, no, mag-continue pa ang diarrhea. So, dito na po mo kuha og fluid sa 40% intracellular. So, mas dangerous. Okay? So, kaya ayaw natin paabutin na mag-severe dehydration yung ating infant. Okay? Sige, naabay question so far? Naintindihan? Ha? Kung mag-health teachings ha, ganyan yung mag-health teacher, okay? Pero ganyan mag-health teachings, okay? That's why gina-emphasize no, ay, ang basulon dayon, di ba, ang hospital, nga nung dili man ma-insert ng IV, of course. Kung mahirapan na nag-insert ng IV, kay collapse, kapag severely dehydrated, mag-collapse na ang veins, no? Kaya wala na may sulod dito na fluid, okay? So, di na kayo na ma-appreciate asa naman ang ugat ani, okay? Wala na may fluid dito. So, mahirapan ng insert ng IV, okay? With that, mahirapan din ng replace, okay? Sige. Next. So, eto na. Ay, last na lang yun. Mo na lang pinaka-last. The teeth, The teeth, kasi part pa siya ng growth, diba? So, teeth, no, the first baby tooth will erupt, no? When you say erupt, ito yung nangyayari kapag eruption, okay? Lumalabas yung ngipin sa gums ng baby. That is your eruption. So, it will erupt. Ang first baby tooth, no, ang pinaka-first na tooth ng baby will erupt at 6 months, approximately, okay? And then, it will be followed by a new one every month. Nakuha? Again, the first tooth will appear approximately, average siya, it could appear pa earlier, but the very common is at 6 months, okay? So, fluoride supplementation should be administered at 6 months, okay? Once na meron ng ngipin, okay? Yung sa manang fluoride supplementation, so katong fluoride good content na mga toothpaste, okay? Yung saan man na pag-administer, of course, the toothpaste, okay? So, hindi yung pamahiin natin na, unya na na-toothbrush yung mga ingon sa kawan na, unya na na-toothbrush yung kompleto na ang ngipon, hindi, okay? So, the moment na mag-erupt na yung first tooth, pwede ka na mag-toothbrush, no? Mag-toothpaste rather sa baby. And then, but very important health teaching, hindi yung toothpaste na Colgate, no, na pang-adult, close-up, na halang, kay dili. Ang i-provide din na toothpaste is yung meron mang label, no, meron mang pang-kids na toothpaste. Yung label talaga, for example, kung gusto nyo rin mo gamitan og toothpaste, yung ating 6-month-old infant na meron ng teeth dito sa baba, okay? So, you have to read the label. For example, nanay, kuan dito naka-label na for toothpaste for 0 to 6 months old or 0 to 12 months. So, bakit? Very important na i-follow because, no, each toothpaste contains different amounts of fluoride, okay? So, dili pwede too much fluoride pod, no? O mo siya sa baby. So, it could be, of course, kanang dangerous pod for the baby, okay? So, mag-discolor ang teeth or makaon sa ni, no? Remember, dili pa na iluwa sa yung baby. So, makaon niya. So, pwede ma-poison nga niya, okay? So, yun nga, kapag mag-toothpaste, diba, usually ang toothpaste sa baby kay medyo fruity flavor, nga na, and then meron ding toothpaste na kanang unsa ni, pwede lang siya maswallow, okay? So dili siya dangerous pag maswallow ng baby. So that's why yung age appropriate na toothpaste yung gamitin if gusto mag-toothpaste ng ating mother, ng ating parent. But actually pwede ra pod siya yung kanang water lang good. Anyway, especially kung 6 months pa no, ang intake pa lang niya is just milk, okay? Pero kung naga-solids na, samot na kung ginapakaon na o kung ano, is so mas important na mag-hygiene para di mag-form ang cavities, okay? Next, deciduous teeth. When you say deciduous teeth, those are permanent, temporary, or other name, baby teeth. Baby teeth or the deciduous teeth, they protect the growth of the dental arc. Unsa man ang dental arc? Erase ko ha. Dental arc is this one, okay? Kanang arc ba? Formation, the curvature of the mouth, okay? So they protect, yung ating baby tooth, they protect na dili ma-deform ang dental arc, okay? So with that, para pag magtubo na yung permanent teeth, okay, form pa rin, okay? So merong formation, or merong place para saan magtubo yung permanent teeth, okay? Sige, so basically yun yung yun yung one of the functions of your baby tooth, is to protect the dental arc. Okay? Sige. Questions? So, dito tayo. So, which do you think ang pinakaunang magtubo ng ngipon? Sa ganito, kung makita nyo sa picture ganina, asa pinakauna, abangan ginin ninyo. Kaya mo ginin pinakauna na mugawas ng ngipon.
Central incisor.
That is?
Central, ma'am.
Central incisors, asa man? Upper, lower?
Upper, ma'am.
Are you sure?
Ay, hindi ko sure.
Sige. Hindi sure. Tanawa sa picture dere. Asa man siya nito ba ang ngipon? Sa?
Lower po.
Lower. Okay. Makitaan ba ninyo sa picture kana siya? Okay. So, that's why, ayan, yung ating lower central incisors. Ito yung pinakauna, Either the two lang. So, pwede left, pwede po right. Basta central incisors, yung usually mauna. And then, after that, every month na nakay tubo ng ngipon. So, lower incisor, kani ang mauna. Kunya, kanina po sa taas, by 7 months or 8 months, ganyan. Okay? Or, kani muna mauna, dalawang central incisor. So, 6 months, then pagka 7 months na po, then pagka 8 months, kanina po na yung tubo, and then pagka 9 months, kanina po na ang tubo. Ganyan. Okay? So, yan yung growth, Please refer na lang to this please refer to this illustration for the growth of your baby tooth, or the deciduous teeth. And when you say shed, kung kailan siya unsa man yung shed? Kailan siya
Mawala, ma'am.
Yes, mawala or di man siya ma-slough off. At sabay term, kanang mapangag, ang ato ang baby. So, ang child, okay? Usually, kung katong kamo, kanang saaman mo napangag og sugod. Kailan, na, yung first tooth ninyo na na shed off? Ano saaman? Ma-remember pa ninyo? Yung first tooth ninyo, napangag ko, ma'am. Mama, papa. So, usually, di ba, sa mo na age? Remember pa ba? Napabukay student dere? 5 to 6, 5 or 6, yes, pwede po. So, usually, again, so, beginning school age, di ba? So, mga grade 1, mga grade 2, grade 3, dira, mga pangag na sila, Because normally, of course, ma-shed off na yung kanilang baby tooth, okay, baby teeth, and then ma-replace na ng permanent teeth, okay? So, ito din yung appearance, kung kailan mawala yung baby tooth, okay? What if dili mo irap ang teeth? Okay. Baka, I do not know kung meron na, hindi pa ako naka-encounter personally, Baka deform, ang teeth, ang pagtubo ng teeth sa ilalim, okay? So, this, hindi man siya very common, but pwede siya, kapag sa wisdom tooth, pantingala, wala pala, usually magtubo ang wisdom tooth 20 years old and above, okay? 22, 23, ang mga na edad, okay? Yung wisdom tooth, diba? So with that, okay, naiuban, wala pala kay wisdom tooth. So basig, nagatubo ang wisdom tooth, pero wala siya nigawa sa gums, kay hiwi ang iyahang ngipon, okay? So instead na naadiri, ang wisdom tooth niya, kay paana ang tubo na ay ngipon diri. So of course, ibunot siya, surgical, sa ni? Kwaon, no? Kung dili siya nagakos ng pain, nakoy kailan, so hindi siya nagakos og pain, so hayaan lang daw. Pero kung nagakos na siya ng pain, that's the time na kwaon siya. So, in-size niya ang gums, and then kwaon tong ngipon na nitubo. Abnormal na abnormal growth of the teeth. Okay? Nahiwi. Sige. So, yun siya. Okay? We also have, I think nag-joke ko no, sa una. Anang teeth, we also have a condition called the natal teeth and the neonatal teeth. Okay? Neonatal teeth. Okay? Actually, this phenomena is 1 in 2,000 ba yun? Tama ba ko? 1 in 2,000 births? Wait lang ha. Asa naman to? Yes, okay? 1 in 2,000. So, in 2,000 babies, merong isa na magkaroon ng natal teeth or neonatal teeth. Unsa man na siya, di ba? Normally, kanus ang mag-erupt ang first tooth at 6 months pa. Asa na to? At 6 months, okay? But when you say natal teeth, no, pag anak pa lang niya, during birth, no, meron na siyang teeth, okay? Pero dili kompleto ha, 1 teeth lang na siya, isa lang kabuok pod, no? So, dili kompleto, okay? So, dili po tumao ka tong nakita na ka, saan po nakita, o basta, so, dili to siya, tinuod na ka ng kompleto gyud ha. So, meron siyang presence of tooth, no, isang tooth, but dili siya, that is your natal teeth. And then, that is very rare na condition. And then, you also have your neonatal teeth. Neonatal teeth naman is the early growth of the tooth, no? Within the first 4 weeks of life. Okay? So, 4 weeks of life. So, basically, your newborn stage, na siya yung ngipon. Okay? Motubo na. Dili man siya, wala siya yung ngipon at birth, but after 4 weeks or within the first 4 weeks of life, nagtubo ang kanyang first tooth. That is their neonatal teeth. Okay? So, again, very rare na instance, no? 1 in 2,000 births. 2,000 babies. Okay? So, unexplained yung niyan, but ginatingnan nila yung calcium content ng body. That's why siguro na dali lang kayo nitubo ang ngipon kay grabe kataas ang calcium sa iyang blood. Okay? Are we clear? So, yan. Magsisend pala ako, by the way, pa rin ng handouts, no? Just like last time. But please, no, of course, listen pa din. Okay? Questions? Clarifications? Meron ba? Stop share ako ha. Wait lang. By the way,
Recording
let us
stopped.
settle pala, be. Okay? So, yung 2E, naamoy recollection tomorrow. Tama ba ko?
Yes
Hello,
po.
2E. Okay. How about the 2J? Saan yung recollection, 2J?
17 pa po amin, ma'am.